webinar is going to start momentarily. And Jessica Jones, would you like to start?
Yes, I will. Okay, so welcome all to tonight's webinar titled Breaking the Silence, You're Not Crazy. My name is Jessica Jones and I will be your host tonight. I am currently a senior at NCCU School of Nursing as well as SNA president. This webinar was created as part of a class project for Ms. Chen's community health class, which focused on Asian American mental health. For this webinar, our learning objectives are identify strategies in promoting mental health through bridging communication gaps between parents and children with cultural competency in Chinese communities. Apply principles of community-oriented interventions and levels of prevention in creating educational materials for mental health education, and to develop communication and leadership skills. Now we will hear from Kaisha Smith, SNA Vice President and Senior at NCCU School of Nursing. Kaisha?
Hi everyone, my name is Kaisha Smith and I'm the current SNA Vice President. Student Nurses Association is an organization that helps students develop professionally. We also offer support and resources to all our fellow Eagle nurses. Since COVID has affected all of our lives, we haven't been able to go out into the community and reach out to all of our student nurses, teachers, community surrounding us. So today we're preparing a webinar. We teamed up with other organizations to talk about mental health and how important it is. This webinar is to increase awareness through sharing personal stories and to share information about the resources we have around NCCU's campus.
Thank you so much, Kaisha. Jessica?
Okay, next we're gonna hear from Dr. Van Riel. Our next speaker, Department of Chair of Nursing at North Carolina Central University, and is also a part-time patient placement coordinator at First Health of the Carolinas Moore Regional Hospital. Dr. Van Riel has 25 years of nursing experience with 20 years as a nurse educator. Without further ado, Dr. Van Riel.
Thank you, Ms. Jones. It is my honor as Department Chair of Nursing at North Carolina Central University to welcome attendees to Breaking the Silence, You're Not Crazy webinar, organized by the Department of Nursing Community Health Nursing Class and the Student Nurses Association in collaboration with the United Chinese Americans and the National Alliance on Mental Health, NAMNE, North Carolina. This webinar exemplifies the mission of the nursing department to prepare compassionate and caring nurse leaders in healthcare who transform communities. The goal of this discussion is not to offer professional medical advice, but to serve as a platform for discussion and to increase mental health awareness. Any immediate concerns regarding personal health, safety, and well-being should be appropriately directed towards your mental health provider or primary care doctor. Thank you.
Okay, moving on, we are going to go ahead and introduce our panel speakers. First, we are going to introduce Tim He. Tim He is a youth ambassador for the USA Youth Mental Health Initiative and has worked with Cornerstone Education in providing services for international students. Welcome, Tim.
Hi, everyone. My name is Tim. I'm 26 years old and I'm almost a native of Chicago. I grew up here. I've been here since I was, I think, 6.5 for first grade, and I've never left the city of Chicago. So my story about mental health is basically about how I crashed and burned through a lot of my college years and was unable to really communicate with anybody and could not feel like I didn't have any support or any system of people or friends that I could turn to, and the struggles that I had during those times. So I think it was about 2010, I entered college early. So I was pretty young for a freshman, and everything was going okay. I was getting used to school, but due to an injury, I'm a musician, and due to an injury, I couldn't really play for more than 15-20 minutes at a time. So it was very, very difficult for me to deal with that, knowing that I wanted to be a professional musician and basically being like sidelined for months and months at an end. Um, with that, I started missing classes, and when I failed a class, I felt like there was nothing I could do. Everything just felt like there was no way forward. And the following semester, when I went to retake that class, my anxiety was so bad that I was just, I didn't want other people to know that I failed the class. So I couldn't make myself actually go and sit in the classroom. And I didn't know what to do at all. I couldn't concentrate. I was barely eating. I wasn't taking care of myself at all. And I turned to things like eating things at like 2, 3 a.m. And that's the only time I'd eat, and heavily drinking to just get through everything and being able to almost function. But it was a full year after that kind of spiral where I just couldn't take it anymore. I was lying to myself. I was lying to everybody around me, trying to keep up appearances, trying to act like everything was okay. But I was completely devastated on the inside. It took me a very, very long time to realize that I wasn't alone in dealing with this kind of anxiety and depression, that it could be something that I could talk to others about. And it wasn't until I started seeing a doctor, with my first therapist and then a psychiatrist, that I started actually realizing that I needed to focus on myself more than what other people think of me, and being able to not compare myself with the things around me and just worry about how I feel and how I approach everything in life. And it was after taking medication, um, it was almost like there was just a fog lifted and I was able to talk to people more and not feel so just anxious, like walking by somebody and looking at them in their eyes. I can like say hi and wave to my neighbors without worrying, like thinking like, I wonder what they think about me. Like, was that awkward? Things like that. And it wasn't until I started talking to more of my friends again and sharing about my experiences, I started realizing and noticing that everybody struggles at some point in their life with how they're feeling mentally. And mental health isn't just something that's going to be easy to fix immediately. It's going to take a lot of work. It's going to take a lot of time. But I think by sharing how I feel and listening to how others feel have really helped me deal with what's going on and help me be a better support for other people around me.
That's my cue. All right. So next we have Sandy Chen, who's our next panelist speaker. Sandy Chen is a youth ambassador for the USA Mental Health Initiative and is passionate about supporting mental health awareness and hopes to become a therapist someday. Welcome, Sandy.
Thank you. So hi everyone, my name is Sandy, and I have lived with a mental illness for almost half of my life. Today I will be sharing a story I almost ended too soon. If you were to tell me a couple years ago that I would still be here telling my story, I wouldn't have believed you. I was in a really dark place throughout middle and high school. My depression began slowly, and then it seemed to hit me all at once. It started with me feeling exhausted all the time. I suddenly had trouble getting out of bed. I felt so many negative emotions that I couldn't explain. I had no idea why this was happening, And it made me feel even more alone because mental health and mental illness was something my family never talked about. I had only heard about depression through those Prozac commercials on TV, and I barely knew anything about it. Sorry. My grades started dropping, and my parents began to notice. Instead of asking me what was going on, they said I needed to do better and to stop being so lazy. I felt like all that mattered to my parents was how well I was doing in school. I felt like I had no one to turn to. I began to self-harm in the 8th grade, and I remember wearing long sleeves when it would be 80 degrees outside just so I could cover up my arms. I bottled up all my emotions because I didn't want anyone to know how I felt. In the 9th grade, I attempted suicide for the first time. My parents came home and found me on the bathroom floor. When I told them what I had done, they responded with anger and disbelief. How could you do this to us? Do you have any idea what kind of shame this could bring our family? Their hurtful questions played over and over in my head. It seemed like my life didn't matter to them and that they cared more about saving face. They refused to take me to the hospital at first. I spent the next 8 hours that night throwing up and losing consciousness. When they saw that I wasn't getting any better, they took me to the emergency room. I stayed overnight and then I voluntarily admitted myself into the psychiatric ward. At this point, I still knew little to nothing about what depression really was. I thought there was something wrong with me. I thought that I was the only one in the world who felt this way. Being in the psychiatric ward was an eye-opening experience for me because I met other people in there who were going through similar times. I left a week later, only to return again in a few months. My parents still had trouble grasping the fact that I had a mental illness. I remember in my family therapy meeting, my dad said I self-harmed for attention. I was so angry at my parents for not understanding why I did the things I did. I was angry at them for not seeing how much pain I was in. I began to isolate myself from my parents, and our relationship gradually grew worse. I turned to drugs and alcohol to escape, and I began to receive truancy letters from school because there were so many days where I couldn't get out of bed. My last hospitalization happened when I was in my junior year. I was being bullied really badly, my relationship with my family was horrible, and I felt like I had no one I could truly turn to. I told one person what I had done, and if he hadn't showed up to my house when he did and told my parents, I would not be here today. They rushed me to the hospital, and I was barely conscious. The doctors ran some tests and asked me some questions. The next day, I was transferred to a hospital that is regarded as one of the best in the nation for liver transplants. The doctors told me I had caused significant damage to my liver and that they had put my name on the transplant list. Luckily, my liver healed on its own as I spent the next week in the ICU. I had never felt so weak in my life. I needed help getting up and going to the bathroom. I slept for most of the time, and I was on suicide watch 24/7. I felt like the biggest disappointment. However, this was a turning point in both me and my parents' life. They genuinely apologized to me and expressed so much regret in how they treated me. From that point on, they became more mindful of what they said and how they reacted whenever I was having a depressive episode. They joined support groups for parents who have a child living with a mental illness. They took the time to educate themselves on mental health itself and how mental illness can severely impact those who live with it. It took a lot for me to forgive my parents, but it took even more for me to accept that I have a mental illness. I used to think of it as a shameful secret that I could never share with anyone. Now I am passionate about advocating for mental health and the destigmatization of mental illnesses. One of my biggest takeaways from my experience is to always give yourself time. If I had given myself a couple minutes to breathe and really calm down and think about what I was doing, I would not have gone through with my attempts. Each time I attempted, I remember there was the instantaneous regret of wishing I didn't do what I did. So please, if you ever find yourself in that situation where you think you want to end your life, please give yourself time. The feeling will pass. When we say we want to end our life, we don't think about the good things we are ending. We only think about the bad things that we want to end. I promise you that one day you will look back and be grateful that you're still here. Thank you.
Sandy, thank you so much for being so courageous and sharing this story with us. I know that a lot of us battle with mental illness in some way, shape, or form, or know someone, and we're all scared, sometimes to talk about that. So thank you so much for sharing your story. Our next panelist is Dr. Sen Shi. Dr. Sen Shi is a third-year psychiatry resident at the Brown University General Adult Psychiatry Program. He currently works in providing general outpatient services to the uninsured or underinsured and also provides therapy for these patients. Dr. Shi, welcome.
Hi, yes. Can you guys hear me right now? Hi. So I'm just going to share my screen so that way you guys can see. I have just a few slides that I wanted to present to you guys. So I'm just going to share this. So I just want to introduce myself again. My name is Sen Shu, and I'm currently a third-year psychiatry resident at Brown University at Butler Hospital. I really appreciate that you've allowed me to share my time with you today, and really hope that you can find something that may be of use to you. The purpose of this discussion today is really to encourage us to think about how we recognize signs and symptoms of depression, and also have a basic idea of who to reach out to and what types of care are available within the framework of mental health. So I'd like to open by talking about some mental health related statistics first. So 75% of lifetime cases of mental health conditions begin by age 24. 1 in 4 young adults between the ages of 18 and 24 have a diagnosable mental illness. More than 80% of college students have felt overwhelmed by all they had had to do in the past year, and 45% have felt things were hopeless. Overall, 40% of students with diagnosable mental health conditions did not seek help, and 57% of them did not request the appropriate accommodations within their school. And the number one reason students do not seek help is because of concern of stigma. And that's something that I want to touch on a little bit later. So I want to spend some time to talk about how we recognize signs and symptoms of depression. And in short, both clinical depression as well as depressive symptoms can manifest as a variety of symptoms that typically begin gradually and can often be in response to some stressor, but can also arise on their own as well. Examples of symptoms include changes in appetite. So you may notice that you may be eating too little or too much, as well as low energy, decrease in energy, as well as difficulty with concentrating. So the way that you may notice this is you have difficulty with focusing on school-related work, or even when you're reading textbooks, you notice you have a lot more trouble focusing than usual. Also feelings of hopelessness or feeling general sense of doom and gloom in the future, as well as changes in sleep patterns. So this can often be, you sleep too little or you sleep too much. The majority of depressed patients actually have symptoms of insomnia that can come about as early morning awakenings. And so this can mean that you find yourself in a pattern of waking up at 4 or 5 a.m. in the morning when you're usually used to waking up at 8 or 9. Other things that are perhaps more subtle are symptoms of irritability, headaches, and stomach upset. And in fact, physical symptoms are quite common in depression, and oftentimes vague aches and pains can be the first presenting signs and symptoms. You may also notice decreased interest in things, and of course, the thing that we are also very concerned about too, and we would want to talk about, is suicidal thoughts, which I'll go into more a bit later. So I want to spend a little bit of time talking about levels of care, because this is something that we don't perhaps talk about as much and is not perhaps as well known about. Within the mental health care field, we have different tiers of care that exists. And what you guys are probably most familiar with is outpatient level. And so this includes, your therapist you see, the psychologist, psychiatrist, basically the people that you schedule appointments with and meet in an office-based setting. This is kind of at the one end, at the base end of the spectrum. And then on the opposite end of the spectrum, we also have inpatient psychiatric admission, where you're actually where you actually stay in the hospital temporarily as a means to kind of help stabilize your symptoms, as well as provide kind of a safe environment for medications to be introduced, and also engage in some therapeutic groups activities. And then between being in the hospital and being in the office, you have intensive outpatient programs as well as partial hospital programs that exist. And these are essentially programs that involve multidisciplinary teams, usually consisting of a therapist, could be a licensed mental health worker, occupational therapy assistant, as well as a psychiatrist or some form of psychiatric nurse practitioner, who typically will collaborate for the duration of the program to ensure that you're benefiting from the treatment. So both of these programs, intensive outpatient and partial hospital programs, are done from the outpatient setting. And so the idea is that you attend the programs for a portion of the day, but you do not stay there overnight. So the duration of the programs differ. Usually with intensive outpatient, it's going to be about a month or even 2 months. And you're usually there for 3 out of the 3 out of the 7 days a week. Whereas partial hospital is it's a more condensed program where you're there for usually a week or two, but it's an all-day commitment. The referral process for these programs is usually done from an outpatient mental health provider, but it can also be done from the emergency room, or perhaps from an inpatient unit as well. If you have been hospitalized, they may actually refer you to one of these programs to kind of offer you a bridge between being in the hospital and being in an outpatient office. So finally, I want to spend some time to talk about suicidal thoughts, because it is a topic that often comes up in the mental health field, as you can imagine. So it's not uncommon in the process of daily life that seemingly uncountable number of thoughts run through our mind. When we go through periods of depression, our tendency will be to ruminate on things that have already happened in our lives, and or things that are often out of our control. When we start to experience hopeless thoughts to the point that we feel like life is no longer worth living, or we even begin to think about concrete actions to endanger our lives, this is a definite cause for concern and should be addressed. I encourage all of you to find a trusted friend or family member that you can share any thoughts that may be especially distressing. And if you were to have any thoughts of potentially endangering your own life, to please reach out. As I mentioned before, stigma is a huge concern within the mental health field, and we hope that by offering these resources and opening up this discussion, we can at least begin to destigmatize the conversation around mental health. I've included a number for the suicide prevention hotline on this slide. And for those that don't know, the National Suicide Prevention Lifeline is a national network of local crisis centers that provide confidential and free support to those in crisis or have emotional distress. And it's a 24-hour day, 7-day-a-week service. Thank you.
Thank you, Dr. Chi, not she. I'm so sorry I pronounced that wrong. Okay, thank you so much for sharing that valuable information. Next, we have Ms. Gail Pruitt. Ms. Pruitt is a retired nurse from nursing in December 2019, but before then, she was a professor at NCCU School of Nursing. Throughout her 50-year career, Ms. Pruitt has focused on psychiatric mental health nursing. Currently, Ms. Pruitt works as an administrative assistant at the National Alliance on Mental Illness, NAMI, North Carolina, where she continues to promote preventative strategies and quality services for people and their families with mental illness. Welcome, Ms. Gail Pruitt.
Thank you, Jessica. And it's good to see so many familiar faces. Hi, everybody. Yes, at NAMI, we actually do a lot of referrals. Dr. G was talking about the levels of care. We do referrals to inpatient facilities, outpatient, private therapists, things like that. So we're kind of a bridge as well. And one of the things that I'm concerned about is our concept of thinking of people as crazy. And I think that is, I'm glad we included it in the title because it's a talking point or a focus for discussion, because that label of crazy can increase the stigma, it can keep the stigma going, and we don't want to do that. So words are important. And we all are on a continuum from whatever society deems as normal versus abnormal. And we're somewhere along that line, whether it's depression, anxiety, or other kinds of signs and symptoms. So in terms of, there's so many things that NAMI does, and I just would love to share all of them with you. After this session, I believe that you all will receive a survey. And at that time, you'll be getting a list of resources provided by NAMI and some of the links and contacts that may be helpful for you. North Carolina Central has an excellent counseling center, and that may be the first line for you to go and ask for help. I've walked many students over there myself when I was working at Central. But sometimes students or their families may not want to use online resources on campus. And so we have other resources as well. For example, if you're in an immediate crisis, what we recommend is calling 911 and asking for a CIT officer. CIT means that the officers were trained in crisis intervention, and they can help provide support, care, and help get you to the right place. We also have a national suicide hotline in addition to the one that Dr. G was talking about, and that's the NAMI National Suicide Hotline. The number is 1-800-273-8255, and that will be on the resource list when you get it. Or if you prefer texting, you can text 741-741, and a trained counselor is available 24/7. NAMI North Carolina also has a hotline which is available from 8:30 in the morning to 5 p.m. Monday through Friday, and that is within North Carolina. That number is 1-800-451-9682, or you can email at helpline@naminc.org. There's also available walk-in services near where you live. They're crisis services, and we'll provide the link for those as well. We can't go through all of them. But in addition, there are regional groups within NAMI that North Carolina that provide support groups. They're called connectional support groups, and they are now virtual because of COVID, but they occur on a weekly basis. That resource will be available to you as well. If you want to learn more, if you have a mental illness or suspect that you do, there are classes called peer-to-peer classes that are taught and shared by people with mental illnesses who have recovered and are doing well and want to share their experiences and learning with others. Then in addition, some of you may have family members who have a mental illness, whether it's something, a psychosis or depression, anxiety, or something else. And so NAMI has support groups for family members to help learn more too. And those are called family support groups. There's also family classes called family to family classes. I'm a instructor in a family to family class through NAMI Durham. So I think I'll leave it there, and during the question and answer period, if folks have other questions or would like other resources, I'll be glad to share those. One thing I didn't mention was that NAMI does have 7 NAMI on-campus groups. Unfortunately, right now, North Carolina Central doesn't have a NAMI on campus, but if a group of you are interested in forming one, what you need is a blessing from administration that another group or club can be added on campus, and then a commitment from student leaders to organize. There is help with doing that, and if you're interested, Virginia Rodelius and her contact will be on the resource list as well, will be available to help you. And she is from NAMI and oversees actually both the helpline resource center at NAMI North Carolina and the NAMI on campus as well.
Thank you, Ms. Gail Pruitt. And I think that I can speak for a lot of people that if you have any type of mental illness, that soothing voice will calm anyone down. Thank you, Ms. Pruitt.
You're welcome.
Now on to our Q&A. Our moderator will be Ms. Lily Chen. Ms. Lily Chen is a lecturer at North Carolina Central University, teaching our community health nursing class right now, and is a certified educator. Ms. Chen is a community organizer and volunteers for United Chinese Americans, which is UCA, as senior advisor and coordinator for Asian American Youth Mental Health Initiative. She is also the board chair for UCA, the Illinois chapter. Welcome, Ms. Chen.
Thank you so much, Jessica, for your great work moderating. as I'm listening to the panelists, I cannot help but just gratitude and also appreciation for Sandy and Tim for your courage and for your care for other people, as well as for your just so generously and honestly, emotionally, and share your incredible stories and experience. I think that we just hope that through these kind of webinars that we have organized since 2016, we have organized about 12 conferences nationwide, and as well as the 3 webinars in the summer, this past summer. The goal is to decrease the stigma and increase the awareness for mental health illness. I think Ms. Poon said it well. It is a continuum, and you're not alone. Many people are struggling with mental illness. And Dr. Shi, and thank you so much also for pointing out that the alarming statistics of how many college students are suffering in silence. I think that's the title said it very well, Jessica, you know, is we wanted to break the silence, and you are not crazy. You're normal. It's normal to feel depressed. It's normal to feel anxious. This is part of our human feelings. And we want you to get help if you feel that way. So that leads to our next section of our webinar, which is a Q&A. So I would like to introduce you our another wonderful student and SNA Student Nurses Association Treasurer, Ms. Sharanka Weeks, who will introduce her class group leaders. Sharanka.
Hello.
Sorry.
Hello. My name is Sharika Weeks. I'm a Russian nursing student, and I'll be introducing the group leaders, which is Anna Nguyen, Renee Metzendera, Tasha Cameron, Alexander Ross, and Maya Vick. And Anna, could you start?
Hello. So my name is Anna Nguyen. My group members are Ashley, Bobby Wally, Jessica Jones, and Alexis Hayes. And do I ask a question? Okay.
Yes, please.
Okay. So my question is, how can we educate how can I educate my parents on why mental health is important?
That is a really important question. We have done a lot of conversations about parent and children conversation and communication, and how the parents can better help their children. I'll let Ms. Poon to start to answer this question. Ms. Poon?
Oh, sure, I'd be glad to. Hi, Anna. So I think one of the things that parents, and it's not just Chinese culture, it's not just Arab Muslim cultures, it's a whole variety of cultures that don't feel comfortable talking about mental illness, don't know very much about it. So I think I would start by kind of validating how they feel. You know, I understand, you know, you don't know much about mental illness, and a lot of people don't, but I would really like to share with you what my experience is, what some of the signs and symptoms are. And when somebody is feeling like very depressed, they can't do well in school. They can't focus. They don't have the energy to engage with other people. That's why sometimes people withdraw to their rooms. So I would start with where they are and validate that, and then build on from experiences that you've noticed from yourself or somebody else to educate signs and symptoms, treatment options, that there is a wide variety of help available, and that people are not alone. It's not a shameful thing anymore to say that you're depressed or anxious or have some other condition.
Thank you so much, Ms. Poon. And Tim, you have shared before that how your mom responded to your illness, and could you share a little bit more with the audience here?
Sure. Yeah, my My mom was my rock, honestly, through a lot of the turmoil I put myself through. She was the one that convinced me to actually go and see a psychiatrist about my problems. I was very, very hesitant for a long time, and even when we agreed, I would call and make an appointment for myself. I just kept putting it off and putting it off. She actually had to like sit me down in front of her and they like make me call with her for me to be able to make my first appointment. I was just reluctant to go through the process and just thought I could do it by myself. It'll be fine. It'll just take me a while, but I can do it. But I'm so glad that she helped me make that call, because without it, I don't think I would be where I am today. And it would have taken me so much longer, or I probably would have never like pulled myself up again. She has always been very, very supportive of me, even when I feel like I couldn't maybe like meet her expectations. I think that's also part of why I kind of fell into a spiral um, of like depression and anxiety, because I felt like I couldn't meet my parents' expectations of what I should be doing and what I should be achieving.
Tim, thank you so much. So from what you're saying is that your mom has been playing such an advocacy role for you when you, just because when the children are ill, they really can't. One of the symptoms is that you may not be able to make decisions slower, may not be appropriate decisions. In this case, that your mom were able to advocate for you. You know, as a parent myself, I have 5 children, and I have children struggling with mental illness too. And I think Anna's question is that what you should educate the parents. I think that I don't know, this question should be reversed. What the parents should talk to their children about. You know, I think that as a parent, I would say that listening is really important. I think your mom did a great job just listening to you, and also unjudgmental. Don't, you know, again, is related to knowledge, right? It's about stigma. Just validate their feelings, like most parents say. And Sandy, that from your story, your parents has really turned 180 degree. I think you definitely has been educating your parents, you know, in maybe it's not the best way, a situation, but they sure have learned. Can you share that what had been the educational process been educating your parents?
So I know that the turning point was my last attempt, and I don't want anyone to have to go through that to make their parents understand. But I think that they were more open to learning about it after they saw, like, they could finally see how much pain I was in, and that like it wasn't just me, like it wasn't just me like being a teenager and like having mood swings or whatever. Like, it was a real condition for me, like it is for so many other people. And I think that in order for parents to like really want to be educated, they have to see where you're coming from. And I think that it takes like a lot of honest and open communication from both parties, from both the child and the parents, to like really sit down and like talk about what you need from each other. And what I needed from my parents was for them to like just really listen, and also give me time and space to approach them whenever I was going through something. So I've talked about it before, where one of the things that really helped mend my relationship with my parents was that they would let me know that they would be there for me if I ever needed them, but they wouldn't pressure me to talk to them about what was going on. And I think that's really important.
Thank you, Sandy. So we have 4 additional group leaders who would like to ask you questions. After the group questions, and we will give the audience you can put your questions on the chat box, and then we're going to pick a few questions from the audience as well. So the second group leader, would you please proceed, Renee, for your question?
Hi, good evening. My name is Renee Mitendera, and I'm part of Group B. I'm the group leader for Group B. And in my group, I have Alex Hammond, I got Jasmine Harris, Nadira Malone, and Tatiana Matos. And I'm part of Ms. Chen's community health class. And the question that I have for you today is, what should I do if someone I know appears to have symptoms of a mental disorder? Like, how do we go about that?
That is a great question. Dr. Shi has shared in your slide about signs and symptoms. So would you please take this question, Dr. Shi?
Sure. Yes. So this kind of goes back to what I've mentioned earlier about recognizing signs and symptoms of depression, and certainly, things that we talk about are in terms of changes in mood, changes in sleep, changes in appetite, among other things. And you can notice that. Certainly, you'll be some people may notice that they're increasingly isolating themselves at home, not really talking to others, losing interest in things that they normally find enjoyable, and even subtle changes such as increasing in headaches, increasing in pain, things that should be paid attention to. And of course, you want to consult with your doctor if these symptoms become problematic, but oftentimes depressive symptoms can often mask as pain symptoms and shouldn't be ignored. Other things that we should be concerned about are generally patterns of erratic, impulsive behaviors, where we may notice you start to engage in risky behaviors such as gambling, substance use, or even start to behave differently around your friends and family. They may notice differences in your speech patterns, that you're talking much faster than usual, as well as periods of times where, even if you notice you or your friend are just out of the blue or seem like they're talking to themselves or talking to no one in particular, or they mention that they feel like they're starting to hear things they don't think other people are hearing, or hear voices in their head. And these are all signs that, that we should be paying attention to, and indications that there may be more serious things at play. Kind of also, as I was mentioning, any discussion of self-harm, or even thoughts of, or even discussion of, possibly suicide, or even, wanting to die, we should always take these concerns seriously. And if it is possible, if your friend is telling you this, if you could reach out to them, reach out to their parents, let them know, because oftentimes they may not feel comfortable, getting themselves to the appropriate location that can help deliver them the best treatment possible. If it is an immediate concern and the parents aren't available, it is also, the 911 is also available. They have ambulances that can come by, and and they can offer and they can help bring your friend to the emergency room, where they can receive the appropriate evaluation and treatment. And I just want to emphasize that any talk about safety or any concerns about safety should be taken very seriously, because this is really the difference between life and death.
Thank you so much, Dr. Shi. And I remember on one of the webinars that Dr. Juliana Chan have a picture. It says one of the symptoms, very vividly is a duck paddling really, really hard under the water, but above the water, it seems very calm, right? So that made me think about when Tim, you share your stories about, because you feel ashamed, you didn't want to let people know. So on the surface, you may be seem like okay, right? But actually you're struggling. And I have seen so many children like that in our culture, that because they're such a high achiever, they're doing so well at school, you're so social, you have so many friends, therefore you shouldn't have a problem. So that's all stereotype. So anyway, thank you so much, Dr. Shi. So I'm going to go to the next question, group 3. Ms. Cameron, can you state your question, Elia Cameron?
Yes. Hi, my name is Tasia. I am the group leader for Group C. The group members that I have with me are Vivian, Nicole, Chinadu, and Happiness. And my question is, can people cope with mental illness without medication? If so, what are some other coping mechanisms?
I'm going to actually, Tim, I know that you started out, all the panels you can just, you can chime in, okay? It's not like, only one person can talk, or 2 people will make it very interactive. But Tim, you have mentioned that when you started to take a medication, you felt like as the fog lifted, right? So could you share a little bit more about your experience with medication?
Yeah, it only really took me 2 tries. I was lucky. The first one I tried made me too kind of hyper, and I felt like my heart was beating too much. But the second medication that I tried, and the one that I'm still on today, only after maybe just a couple, like a week and a half, I started to kind of be able to interact with people and go outside of my original comfort zone. But I think it was after maybe 6 months to a year before I found the correct dosage that I'm still on today. Yeah, so I've been taking medication for the last 3-4 years now. And I don't really mind it. It's just something that it's a habit now. And I always make sure I have my prescription, or else I do kind of freak out if I'm running low. But it's something that I definitely recommend to people who have these kind of anxious tendencies, or just times when they feel like they can't do anything or can't encourage themselves to do anything that they love. But it's not for everyone. There are people who have different reactions to different medication, and I was lucky to only have to try 2 different kinds before I found the correct one for me.
Thank you, Tim. Sandy, what was your personal experience with medication?
So I'm still taking medication today, and it's helped me a lot. I honestly don't think that I could function without it. But aside from medication, there's also like a lot of other factors that go into like what helps me, such as having like a strong support group. I have my parents are really supportive now, and that makes all the difference in the world.
Mm-hmm.
And I have, good friends by my side that I know I can turn to if I ever need to.
Mm-hmm.
And I've also had a therapist in the past. I'm not currently seeking therapy right now, but it just really helped having that person that you could go to and tell them like anything, and they would sit there and listen and like give you advice if you needed, or it was just nice to have someone there that won't judge you, no matter what you're going through, and that you can be honest with them, and they'll just listen to you. And aside from therapy, like it's also important to get yourself involved in things that you like doing. Like I know it's hard when you're depressed and you feel like you don't want to do anything, but it's important to just push yourself, like maybe just go outside and take a walk, or read a book. I know sometimes it's really hard, especially when you're not feeling like you're interested in anything anymore, but just whatever takes your mind off of whatever you're feeling at the moment, whether it's taking a bath or reading a book, like I said. So I think aside from medication, there's a lot of other things that you can focus on, such as like therapy. There's also different kinds of therapy, like group therapy or pet therapy or art therapy. Personally, I like painting and writing and reading, so that's helped me a lot as well. So yeah.
Thank you so much. You talk a lot of other methods to help in addition to medication. So Dr. Shi, when is a good time? Again, we have to have a disclaimer. We're not offering any advice. This is educational. So if you have any issues, you have to seek your own personal physicians and psychiatrists, but this is educational in purpose. But as a psychiatrist in training, Dr. Shi, could you share your experience as a psychiatrist?
Yeah, sure. Thank you for that. So as we kind of mentioned, there are certainly a lot of different techniques that we can use to help manage our symptoms as far as depression and anxiety are concerned. And oftentimes these symptoms, we do typically recommend that in addition to medications, if they are used, that people also engage in therapy, because there is a kind of combined additive effect that we see with therapy as well as medications. So, we do get asked this often, at what point it is appropriate to take medications. And it's important to kind of recognize that a lot of our mental illnesses, we kind of see along a spectrum, and things like depression and anxiety there are grades of depression and anxiety, and there's certain, there's certainly ways that we can see depression as being severe and anxiety as being severe. If you feel like, for instance, if you feel like you're not able to get out of bed at all, you don't feel like you can clothe yourself, bathe yourself, eat, that would be a sign that that your depressive symptoms have gotten to the point where it's really significantly impacted your life. If you feel like with your anxiety that you've just completely lost the ability to focus in school, you can't concentrate on your school, on your work, and your mind is going a million miles a minute, and you just cannot you find it very difficult to sleep at night. These are also things that are very disruptive to just your body's general rhythm and your ability to maintain appropriate function in your daily life. And so these are definitely good reasons why you may consider medications. And again, these are discussions to have with your mental health provider, with your primary care provider, if you feel like they are, if the symptoms are really becoming problematic. It doesn't necessarily, and even when you start taking these medications, it doesn't necessarily mean that you'll have to take them forever. And oftentimes people will start to wean down on these medications as they notice that their symptoms have improved, and they feel like they've gotten to a point where they can maybe start to decrease on it. But really, we should, you owe it to yourself to give yourself the best, give yourself the opportunity to be the best you can be. And sometimes medications can really offer you that extra boost needed to get you back on your feet.
Mm-hmm.
Okay, thank you so much, Dr. Shi. So we are going to move along. We have two more group questions. And Mr. Ross and group 4, can you state your question?
Yeah, hi, my name is Alexander Ross. I'm also a group leader. So in my group, I have Erica, Elizabeth, Jennifer, and Brianna. And mainly, I just wanted to talk about like culture as far as mental health. So like, I know you mentioned it earlier, Dr. Pruitt, but does culture play a big part in how we approach mental health?
Who would like to answer this question?
I could start with that, and then other people can jump in. Yeah, it can. It can. I think that mental illnesses are more universal across cultures than we think sometimes. But one of the nature of having a mental illness is that you think you're alone, or your family's the only one that's going through it or doesn't understand. Whereas if you actually are able at some point to reach out to others, you find that lots of people have that same kind of example. But for those of you who had psych with Dr. Sajaya, you know that there's lots of cultural aspects to people's perceptions of health and illness and mental health. And so there are things that, for example, the causes of mental illness. Some people may think it's because you did something wrong and you're being punished, or that there's a imbalance in some way. And so in that way, culture can play a part, and also the treatment, what's acceptable and what's not. If there are traditional doctors who use traditional medicines, or who use, I can't think of the name of it, but like sage and burning out different kinds of bad humors, then they often are used in combination with Western kind of therapies as well. Here we go.
Thank you. I'm the one telling everybody need to unmute. But, so thank you. Sandy, I would like to you to share just about your culture, just your parents' reaction just resonate with our community a lot. So could you share a little bit more about how you see the culture plays a role in your mental illness or health-seeking behavior?
So when I was first diagnosed and everything, my parents didn't want to tell anyone in our family. They wanted to keep it a secret because they thought it was a shameful thing to be diagnosed with a mental illness. And that played a huge part in the way I thought about myself and the way I perceived myself. And I just began to really have a low self-esteem. because of it. And I think also there's in my culture, and I'm sure it's a thing in other cultures as well, where we call it saving face, where we don't want to like broadcast our failures or our mishaps or our mistakes, because we want to be seen as like the best, or like we want to be seen as put together and we have like everything under control. And so yeah, so when I was really going through the worst of it, and my parents they were just more concerned about how it would look like to other people, like to their friends, their families. And I remember my first attempt, when we went to the hospital, the nurses kept telling me, like, there's no way your parents are angry with you, like, they're just confused, they don't understand what's going on, but there's no way they're angry with you. And I was like, no, they're angry with me, because like they kept telling me that I brought shame upon them, and it was just really hard to hear, especially coming from your parents, because at my age, like, all I wanted was to make them happy, all I wanted was their approval. And I think culture really played a big part in their understanding of mental illness, and I think it also held them back from looking for answers and looking for looking to be more understanding of it. But obviously, I'm fortunate enough that they opened their minds up and really tried to understand me more.
Thank you so much, Sandy. You're saving a lot of people from your courage, and thank you. So we're going to go to the last group, Miss Wick, Maya Wicks.
Maya Vick, I'm the group leader for Group E. And the members of my group are Asia, Janessa, Sharika, and Mahogany. And my question has already been answered, but okay. It was, what are the warning signs of mental illness? And I think we went through that a few times.
Oh, well, thank you so much, Maya, and really appreciate our wonderful group leaders in the class, and they have coordinated another class project as well. So we're going to open to the audience for the audience questions. Ms. Put, would you like to pick a question to ask? Because I didn't have time to watch the chat box. Or Dr. Shi, would you like to pick 1 or 2 questions to ask? We have it's 8 o'clock, but we're going to discuss 1 or 2 questions, and then we're going to close.
So Jessica had asked, is there such a thing as high functioning when it comes to depression or anxiety? And I think Dr. G answered that pretty well. Does anybody, were you all able to see his response? And is there any other follow-up that you would like on that?
So yeah, anyone from the audience or the group leaders like to answer, or from the panelists? So would you like to answer the question, high functioning?
I guess I would consider myself all the way through high school to be pretty high functioning, able to get through my anxiety and how I felt until something big happened where I just wasn't able to deal with anything else. Did it really come to surface that I can't deal with a lot of just like conflict or even just communication with people makes me very, very like nervous, and I had trouble doing any sort of public speaking or getting on stage and performing was something that I, as a musician, felt was extremely difficult when it shouldn't be. So yeah, I definitely would say there are many, many different levels, and a lot of the things that you do and might kind of help mask the feelings that you show to the outside. So it's pretty easy to kind of fly under the radar sometimes.
Mm-hmm. Yeah.
Yeah, I have shared earlier before, I think from my personal experience of one of my children was exactly that. I would think that all the parents, she's so talented, so, blah, blah, blah. She's very, very sweet, obviously, very, performs very well. And I wish I knew what I know right now as a parent. as a high functioning. I was one of the parents that said, oh, just like, no, that's impossible for anything goes wrong with her. She excels in everything she does. But it's just like that duck paddling so hard under the water until she just couldn't handle it anymore, because she has to put up that effort. You know, she has to live up with that expectation, and she has to just extremely difficult. So definitely the answer is yes. I just hope that other parents and also the community members or whoever, it takes a village, can recognize those symptoms and support the children. So so let's take another question before we close.
There is a question from Erica.
Okay.
It says, is it possible for a person to be suffering from depression and not realize that what's going on?
That's a great question. Who would like to answer that?
I would say definitely yes. And some of it gets to what Tim was saying. You tend to build up defenses or block how you're really feeling, and don't want to see that you're not focusing as well. It's harder to think. You're slower. You want to stay more by yourself. And I think we do protect ourselves in a lot of ways from how we're feeling. And that can block recognizing depression as well.
And that's why these kind of webinars are so important, is increase awareness and educate about mental illness and go to resources. I think that another thing I would say, sometimes you're not sure, just ask, just go to a therapy, just ask for some help, right? Go to even your primary doctor to tell them how you feel, and then you might not realize, to share with your friends and family members, and seek out the resources and student like NCCU or NAMI, and so maybe other people can help you realize and help you get help. All right, so now is 8:05. I guess if anybody would like to, do you have any burning questions you can ask? You can unmute yourself and ask. How about that? We give you an opportunity for you to ask live questions. You can, if you have any questions, you can unmute yourself and ask a question that you are not be able to post on the chat box.
While they're thinking, Ms. Chen, there was a question from Renee earlier, which is, how do you help a friend who is showing mood disorder symptoms?
Okay.
And one end of that spectrum may be the depression that we've talked about, but the other end may be what Dr. G was talking about, some in terms of anxiety, all that extra energy and talking fast and thinking fast and hard to focus and concentrate, doing so many things. And sometimes people don't take feedback on their behaviors very well, but I think my experience has been, if you sit down and talk with a person in a caring way and say, I'm concerned about you. I've noticed whatever you've noticed, and I'm wondering how you're doing, and encourage the person to talk and find out if they'd be willing to let you help them or get them, some professional help.
Well, thank you for that, Ms. Purin. And that is, these kind of education webinars is never enough, is always not long enough. However, we are coming to the end of the webinar. So I just would like to share a few things that we have done in the past. If Tim, you can, another resources as well. Tim, you can show the slides of the 3 webinars we have conducted before, and that you can go to the website. We have 3 webinar recordings on the website that if you're interested, you can go on the website. I have assigned 1 webinar recording to our students and the community health students, and I hope that you have watched that already as part of the clinical. And And also, we do have a survey that we would like you to fill out about this webinar. If you cannot, as team is preparing for the slides, and we are going to encourage you to expect to receive an email from us and asking you to fill out the surveys. So these are the 3 webinars that we did July, June, and August. So this is the website that you can go on, is on the playlist, and there's some segments as well. So you can listen to those. And one, the June one is in Chinese, and then the July and August ones are in English. So, and the next slide, please. So this slide has a link for the survey, the barcode. So if you can just scan that, you can fill out that survey. That will be awesome. And I'm going to turn to our wonderful host, Jessica Jones, and you have done a wonderful job along with your peers, Kaisha and Sharika. So Jessica.
All right, so this is the ending of our webinar. Just want to say thank you all for being here tonight and taking the time to listen to all our wonderful panelists. To the panelists and speakers, thank you for taking time out of your busy personal and professional schedules. It is truly appreciated. Thank you to all who participated in bringing this all together, especially Ms. Chen. Thank you again for all thank you again for all who attended. I hope this webinar would be beneficial for everyone and look forward to seeing more webinars in the future. All right, thank you.
Thank you everyone for participating, and good night.
Good night.
Thank you. Good night.
It was great. Thank you.
Thank you.
Thank you all the speakers and Dr. Van Riel for your support. Dr.
Thank you all.
Thank you, everyone.
Smith King.